We appreciate you being here on this extremely important issue. As you know, we at the Missouri Chamber have been partners with the Missouri Hospital Association and my colleague Herb Kuhn in trying to promote Medicaid transformation and reform in the state of Missouri. It's a very emotional issue. It's got obvious ties with Obamacare, and which we try to differentiate from. And what we're going to produce is hopefully a Missouri solution to this. But these days, and in the last 5 years or so, you cannot find a politician that doesn't want to talk about job creation. And it doesn't matter whether there's an R or a D behind their name, they're in favor of creating good jobs for Missourians and around the country. We are talking about health care today and the importance of that to our economy. Healthcare accounts for about 20% of our economy in the state of Missouri. It's a huge portion of what generates good incomes and family supporting jobs in the state of Missouri. What we are announcing today with the Hospital Association is through their work and surveying of their members, healthcare providers across the state, in urban areas, in rural areas, all around. They've identified a very real and dire trend that we are seeing job cuts, and we are seeing capital projects get delayed. We're seeing other negative impacts of inaction on the Medicaid front. Obviously, the Missouri Chamber of Commerce and Industry is a business organization. We view this as a business issue. We view this as a jobs issue and part of our generating a decent economy for Missouri. So we're happy to partner with the Hospital Association in alerting the legislature and the public to what could possibly happen if we have another year of inaction. Right now, I'd like to turn it over to Herb for his comments on the impacts to the healthcare industry in the state of Missouri. Herb?
Dan, thanks, and we really appreciate the partnership that we have with all of you. You know, for over the last year, we've talked a lot about the math of Medicaid reform here in the state of Missouri. What we know is new taxes have been levied. What we know is cuts to healthcare providers, principally hospitals, have been taken out to be used to finance new care for the uninsured and the working poor in the state of Missouri. What we also know is the state of Missouri has refused to bring those tax dollars back to Missouri. And as a result, what we do know is those dollars are going to neighboring states and other states across the country to help finance their healthcare infrastructure in those states that are out there. So there's been a lot of predictions. What does this mean for the state of Missouri? And so now, for the first time, we're able to paint a little bit more of a clear picture of what it means for the state of Missouri. And let me go through for you what we're seeing in the results of this survey that we did of our members. So over the last 2 weeks, we surveyed the hospitals across the state. 84 hospitals responded to the survey that's out there. So the first issue we looked at is the workforce, what's going on out there. And as a result, what we're seeing is a lot of announcements of layoffs and job freezes that are out there right now. What our survey shows is nearly 1,000 jobs have been lost in the state of Missouri over the last year. And what we're also seeing is that 2,145 jobs have been frozen as a result of inaction in this area and other activities that are going on across the state. So the total is more than 3,000 jobs have either been eliminated or suspended in the state of Missouri over the last year in the healthcare sector. And more than 1/3 of those layoffs and hiring freezes are in the rural areas of the state. The second issue this survey looked at is capital investment. 37 of the 84 hospitals said that they're either canceling or delaying or suspending capital investments in their communities that are out there right now. 70% of those projects are in rural areas. Total capital expenditures that are being delayed or suspended or canceled altogether, between $50 million and $102 million that are out there. The third issue looked at service line. 40 hospitals said that they are going to either cancel or eliminate unprofitable business lines. Now, hospitals do this for a variety of reasons because those communities need those services. But it's hard to maintain them when you're looking at the losses that they're experiencing right now. So about 40 hospitals are reporting service lines that are closing. Many of those are in rural areas. And what we're starting to see is the prediction that many felt would happen in the state of Missouri is that we're starting to see medical deserts being created in parts of the state of Missouri. That ought to be a real concern for everybody in this state. And the final issue that we got some information on, we didn't necessarily poll for this, but the hospital shared this, about the increasing difficulty they're having in terms of recruiting physicians, new physicians, other healthcare professionals into the state, into their communities that are out there. Tom Holloway, who runs the Missouri State Medical Association, and I opined on this issue in an op-ed here a week ago. And what we're beginning to see across the state is that healthcare professional recruiting firms, those that help folks across the state and others across the country recruit healthcare professionals, are starting to differentiate between states that have done Medicaid reform and those states that have not. And basically putting those states that have not into the second tier. The reason is because basically those are the states that have less investment in healthcare, have more bad debt, more uninsured, those kind of issues that are out there. And when you add to the fact that we have that unfavorable ruling on medical liability reform from our state Supreme Court a little over a year ago, we're kind of in the second tier of the second tier. What that means is, as we look in the state, and as Tom and I opined on, is the fact that Missouri doesn't have the welcome mat out anymore. Basically, we have a beware of dog sign at the borders of the state. That's a problem when you think about health care for the future of Missouri. You know, there's an app that we can all get for our smartphones, and that app is Snapchat. I think people know what Snapchat's all about. It's a chance for you to send a message to someone, and after they look at that message, whether it's a video, whether it's a picture, whether it's some text, it disappears. I think there's a lot of folks in Missouri that would like to think that this issue is going to disappear. It's not going to disappear. What you're hearing today and what's disappearing in the state of Missouri is jobs and access to care all across the state, but particularly in rural areas. What you're hearing here today is what's disappearing is capital investment in communities across the state to bring the best health care that we can to Missouri. And what also is disappearing is the fact that our ability to recruit the best health care professionals into the state is disappearing real fast on us. What is not disappearing, however, is this problem. It's here to stay. It's with us. And what we need is really inspired leadership here in Missouri to bring this forward, bring this to a conclusion, to work together to create jobs, to make it easy to recruit healthcare professionals, to get investment in the state of Missouri in healthcare. So Dan, let me turn it back to you.
Thanks, Herb. Thank you, Herb. And excuse me, as Herb articulated, this is a problem. It's not going away. If people want to stick their head in the sand and pretend that it's going to solve itself or that we don't have to do anything, we think that's the wrong attitude to take, and we really need action on it this year to capitalize on this and to prevent some of these trends from occurring.